gotten a few questions online this week, so let me talk about them a little bit. The first one, when it comes to pressures, and pressures can vary greatly depending on a couple things. The primary reason that pressures will differ between your upper extremity and your lower extremity, and between different types of cuffs, is limb circumference, how big that limb is. And it doesn't look like it necessarily matters if that limb is very muscular or if that limb is got more adipose or fat. It's just really about the circumference, because the bigger the limb is, the more the cuff has to squeeze in order to get to the arterial or the artery. And so you're going to require higher pressures. Now, a common mistake that I see is that when people inflate the cuff, before they inflate it, they don't tighten the cuff up all the way. So when you put the cuff on, I'm going to take it up as high as I can go. Okay, and then from here, like it's not that tight. I can get a couple fingers in here. It's too loose. And so when you go to plug in the pump, the pressures are going to be much higher because the cuff now has to take all the slack out, and then it's going to start to inflate. So instead, what I want is to have this cuff up as high as I can, grab it, tighten it as much as I can, and then lay it down. And now I can't get two fingers underneath. You should only really be able to get one finger underneath, and that's if I really shove it in there. So I've got one finger in there. That's as tight as I can really get it. And now you'll see that I have the stem facing forward. And why do I make sure that I do that? Is so that it's easy for me to connect. So I've got my clip, and I press down the clip. I don't know if you heard that, but when the clip is depressed, now I can easily plug that into the stem. Let me try to do that again. So, okay, so I'm just clicking it to make sure that it's depressed, and then I plug it in. If at any time this is difficult to get on, like you're like, gosh darn, this is really, really hard, just take a little bit of Vaseline, very small amount, or even massage lotion, and just put it around this. Now we've primarily fixed that with the Gen 3 cuff, because we're using a different O-ring. It doesn't even look like there is an O-ring on this one. Looks like we were able to get rid of the O-ring. On the older versions, the O-ring after a few months would dry out a little bit. It'd be tough to get this on, but it should just clip on super easy. Now I can just go to my my pump, and I'm going to hit start exercise. Now my arm is relaxed and by my side. Okay, arm, and I'm just going to do a manual set pressure. Okay. And that's going to inflate it all up. And once it gets to the pressure, so it's that fast, and then I can disconnect, and it would probably be on both sides. So I would inflate both very quickly, and then I could do my exercise. And then after I'm done with my exercise, then I can either deflate. I primarily deflate with these new cuffs, just pressing and just deflating it. And this would be between each exercise. And then within a minute, I'm going to get to my next exercise. So if I'm going to do, say, some arm work, I might do some bicep curls, okay? Deflate, minute later, inflate, tricep extensions, deflate, and then go to my third exercise. And I typically stick between 3 and 5 exercises for a body region, either upper extremity or lower extremity. And I'll combine compound exercises, meaning multi-joint exercises. So like something like a modified push-up is multi-joint because it's shoulder, it's elbow, versus an isolated exercise like a bicep curl. So I'll mix those in. If it's a very complicated movement, like a air squat, then I'll typically do those first when I'm not tired, and then do isolated exercises afterwards. And there would be some reasons to do the opposite, to wear out the smaller muscles. So you put more emphasis on the bigger muscles, pre-fatigue the muscles, as we would call it. But that's kind of for a different story. This is just an overview of kind of how to get the cuffs on, and making sure that this is, nice and snug before, again, only be able to get one finger underneath there. I can't get two fingers underneath there. So yeah, make sure that those are nice and tight. So I got a question from Lewis. Do the results, strength hypertrophy, from using low pressure versus high pressure as appropriate for your LOP range differ significantly? If so, can you explain? Gosh, it's, as more and more literature comes out, if you would have asked me a year and a half ago, I would have said that you need to have higher pressures for better results. Now I'm kind of changing that tune. It's a balance between comfort and be able to do the exercise and the pressure. So for the legs, per se, I typically am going to be at 60% arterial occlusion pressure or LOP. Now that range can go all the way up to 80%, but I'm finding that people really can't train that well, or it alters their movement pattern at 80%. And I don't think you get that big of a difference. I think comfort is important, and you need to be able to go through the whole exercise protocol. So I would tend to be at the lower pressures. In the upper extremity, it doesn't seem to be as significant. So you can be at that 50% arterial occlusion pressure. Of course, this is after a first couple of weeks. You want to give yourself 3 to 5 sessions in order to kind of what I call on-ramp into normal BFR. Again, the ranges are 40 to 50% arterial occlusion pressure for the upper extremity, 60 to 80% arterial occlusion pressure for the lower extremity. Start low, increase until you get to the maximum. If it affects your ability to move your limb or to move the weight, then drop the pressure a little bit. But I don't think, as long as you're at the minimum, I don't think that there's a bigger differences. Lewis, if you're not seeing much difference, I would increase the load. So I would bump up your pressure to 50%, and then start increasing the load. And the load will change drastically very quickly within a couple weeks. So we redo 1 rep max for the people that I train. We redo our 1 rep max every month, because 20% of let's say you have a 100-pound bench press is a big difference than if it jumps up to 120, there's just a big difference there, 20% in that case. So make sure you're redoing your 1 rep max if you need to. Now, your other option is to just go to failure. If you have enough time in between your training sessions, like let's say I train on Monday, my upper body, and I'm not going to train upper body again until Thursday, go to failure. You're going to get better results if you go to failure. You're just going to cause more exercise-induced muscle damage, and you're going to have more soreness. But if you know that, it's fine. You're just going to give yourself more time before you go into that same region. But, anytime you create more mechanical tension, the better result you're going to get. Any other questions today? I'm doing a 5-day split, hitting each body part except the arms twice per week. Is it possible? No, I don't think so. No, twice a week is fine. Are you doing the 30, 15, 15, 15, or are you doing it to failure, or what is your kind of your rep and set scheme? Yeah, so what I would do is, if you can do the 30, 15, 15, 15 pretty easily, then I would bump up your load. I would bump up the resistance. Oh, 60-second rest. Your load is pretty good. That's okay. With the cuffs inflated, it's fine. All right, cool. So if there's no other questions, I will be seeing you guys next week. I'm going to start posting these on my new BFRuniversity.com website. That's where people will be able to go to find the replays of these. And then also once my pre-order for my BFR book comes out, which will be probably, it'll be back from the editor next month. So I'm going to guess May, June. Then you'll be able to get it from the BFR University site. Josh, what percentage do you recommend for BFR for cycling? So there's two protocols. The first protocol is kind of a steady state protocol, and that you're going to be at least 130 millimeters of mercury pressure or 60%. So either or, I mean, no less than 130 millimeters of mercury or 60% of your limb occlusion pressure. So, and then steady state is up to 20 minutes. I try to keep the revolutions per minute consistent. So you'll do like 70 revolutions per minute and increase the resistance on the bike until your heart rate gets to about, depending on how fit you are, between 30 to 45% of your heart rate reserve. If you're not sure how to calculate heart rate reserve, go on my YouTube channel, just Ed Cara on YouTube, and you find my heart rate reserve, how to calculate that. You're going to be, depending on your age and your fitness level and your resting heart rate, you're going to be right around about 95 to 110 beats per minute, steady state. We also have protocols that I'll be releasing once we're all caught up with getting our cuffs, back orders caught up. Then we're going to release our level 2 course, and the level 2 course will be performance training, where you're not really doing rehab, you're doing more performance. And in that course, I teach a couple of different techniques using cycling for sprinting. So sprint cycling, 30 seconds on, then jump off the bike, 2 minute of BFR, then deflate, 2 minute rest, then 30 second, and you do 5 rounds of that twice per week. Do you need level 1 to take level 2? Yes. Yeah, because there's a lot of, that's where all the contraindications are, but you can do it online. So we have the online level 1 now, and then I'll have online level 2 probably after I teach the course a couple times, and then I make sure that it's where I want it to be, and then we'll put it on we'll put it on online at some point. Yes, definitely this year. I mean, I have it ready. We're just waiting for the cuffs because it's hard to teach online when we don't have the cuffs available. And so we want to have the cuffs available so people can practice it. So it'll definitely be this year. We'll have level 2, and we'll be definitely caught up with back orders. I'm being told that by the end of March, we'll be caught up with all our back orders, and we can kind of get away from this COVID stuff and get back to normal. So I think I have my first training in over 14 months, live training. I believe it's going to be in Florida at Jackson State in May. And then I've got another course. Oh no, maybe that's April. And then in May I have in Vegas. And then I've got a couple other conferences that I'm going to be teaching. So we're going to start getting back into these live trainings as more people get vaccinated, and it's safer for us to be in live setting, especially in some states. Texas, we can do it already, but California, we can't. So it just depends on governance. All right, y'all, thank you so much. I appreciate y'all being here. If you need more training, go to smarttoolsplus.com. We have a lot of free information and free training on there, a couple webinars that I do. And then we also have Con Ed and certification level 1 on Smart Tools Academy, Smart Cuffs Academy, actually, .com. Okay, thanks a lot. I'll see you next week. Bye for now.